Hi, right then, so this is the third of our videos on the blood supply to the head and neck. We've done the entirety of the arterial supply, and what we're going to concentrate now on is the venous drainage to the head and neck. We can push all this stuff up there, but it's got to come back somehow. So this is going to involve, this is also going to involve the dural venous sinuses. So we'll talk a little bit about them first, okay? So let's just make sure that we've got things clear, okay? There are several dural partitions in the head and neck, okay, and you'll probably be familiar with these. Okay, this is the falx cerebri, which is dividing the cerebral hemispheres, and it continues down here as the falx cerebelli to divide the cerebellar hemispheres. And between the cerebral and cerebellar, cerebrum and cerebellum, we've got the tentorium cerebelli. Okay, and the only other one that we need to know about covering the cavernous sinus is the diaphragm celli. Okay, so that's across there. Now, the way it works, let's just make sure that we're absolutely happy with this, okay? We've got several meningeal layers, okay? We've got the pia mater, we've got the arachnoid mater, and then we've got our dura mater, this tough, fibrous dura mater, okay? And it's actually got two layers to it. It's got a periosteal section, which is the bit closest to the bone, and it's got a meningeal section, which is the bit closest to the arachnoids, to the other meninges, okay? And at these partitions, what happens is that the periosteal bit stays attached to the bone, and the meningeal bits divide and meet each other. Okay, therefore creating a space where venous blood can collect. Okay, so this would be a sinus. So what we're looking at the minute is a coronal section through the superior sagittal sinus. Okay, with our two cerebral hemispheres here. And if we look at the bottom of the head, okay, so we've got foramen magnum here, again this is a coronal section, you'll see that what happens as we get to the spine, because there's only one layer of dura across the spinal cord, okay, is that the periosteal layer reflects back across the other side of the skull, okay, to form just straight periosteum, and the meningeal layer continues down here onto the spinal cord, okay, to form the dura of the spinal cord. And this is just a lovely little demonstration of the falx cerebri and the tentorium cerebelli and the diaphragm celli across here. Now, what we need to do is we need to have a think about how our venous drainage works. Okay. Now we've got a few things to consider here. Right. We need to drain the outside and the inside of the head. Okay. Now, what I want you to be absolutely clear on is this: is that there are no valves which are, in the sinuses or in any of the veins that are heading towards the heart. Okay, the major vein, the internal jugular vein that we met before, which is coming out of the jugular foramen here. Okay, can you see that? Okay, so the major vein, the internal jugular vein, is going to basically be the final collecting port for pretty much all of these veins. Okay, and all of these venous systems. Okay. It's going to go straight down to the heart, okay? And there is no valves in it either. Now, why I'm telling you that is this, is because any infection that gets in through anywhere on the face, okay, be it a periorbital infection, periorbital cellulitis, be it any kind of nasal infection. We sometimes talk about the danger area across here as a result of this, but it really refers to the whole area. Any dental abscesses, okay? If an infection gets in to the venous system, it will manage to track its way very easily with no obstruction from any valves or anything like that, okay, back into either the sinuses or into the other venous plexuses, okay, and get eventually down to the jugular vein and straight down to the heart. So what does that mean? That means that an infection across here is absolutely catastrophic, potentially. Okay, you can get systemic sepsis and whole system collapse. Okay, so we need to be clear on what our venous drainage systems are. Okay, so if we have a look at this, okay, what we're looking at is a sagittal section through the nose, okay, and it just basically demonstrates that we've got three areas that we can really drain into, okay. We can drain into an area called the cavernous sinus, going upwards, okay, and I'll show you the cavernous sinus in a moment, okay. We can drain this way, okay, and head sort of outwards towards the cheek, okay, and that would head towards the pterygoid plexus, okay, and that goes to the infratemporal fossa. Right. Or we can drain outside of the face onto the facial vein, and all of these will head back eventually to the jugular vein, and this is how. Okay. I mentioned the facial vein, the pterygoid plexus. Okay, so what we have here, this whole network of veins. This is the pterygoid plexus. Okay, and the pterygoid plexus is just collecting from this entire region in the infratemporal fossa. Okay, and anything that's sort of like coming through from the nose, from the some branches from the orbit, and also from the mouth will head this way, and they'll eventually form a single maxillary vein. Okay, now that maxillary vein meets with the superficial temporal vein. Okay, you remember the superficial temporal artery? We've got superficial temporal vein, and the two of these together head behind the mandible, okay, and therefore they're called the retromandibular vein when they join together. Okay, so it's the retromandibular vein. That there stays there. Okay. Now in the meantime, the other place that I mentioned to you was the facial vein. Okay, so this is the facial vein. Okay, and it's coming in roughly the same distribution as where the facial artery was before. Remember, I said before that it had a tortuous trip across the inferior border of the mandible. Well, this is the facial vein going in the same kind of direction. Okay. Now the retromandibular vein and the facial vein meet, and where they meet, they form the external jugular vein. Okay, the external jugular vein. And of the jugular veins, this is the smaller one. The internal jugular vein is the bigger one, but the external jugular vein will eventually meet with it on its way down to the heart. Okay. So where does the jugular vein come from? Well, the jugular vein comes from these sinuses before. Okay, so this here is a little demonstration of the sinuses. Now, I said before that they are within the dural partitions. Okay, so let's have a quick run through this. Okay, this is a schematic diagram of the head. Okay, and for starters, okay, any venous drainage from the orbital cavity, from the nasal cavity, from the oral cavity, these can head to a few different areas. Okay, can head towards the, we mentioned before that they could head towards the cavernous sinus, which is across here. Now I'll just show you where that is on the skull here. Okay, we've seen before, this is the optic canal. Okay, this is the orbit just lying across here, and the nose is sort of down there. Okay, this here, above the pituitary fossa, is where the cavernous sinus lives. Okay, so this is the cavernous sinus. Okay, like I said before, if an infection gets into there, we can have catastrophic damage. Okay, I'll show you on another model where this lies. Okay, so that's your optic chiasm, that's your carotid arteries. Okay, this is your cavernous sinus just overlying the pituitary fossa. Okay, so that's one place that that veins can drain into. Okay, they can also drain directly into this sinus here, okay, the superior sagittal sinus, which we saw the section of before. Now let's see how this works. Okay, we've got the falx cerebri, okay, and we can have drainage from the superior sagittal sinus, which will go all the way back to the back of the head here, okay, or at the bottom of the falx cerebri, there's also one called the inferior sagittal sinus, which also drains in this direction. The thing about the sinuses is you just need to understand the direction of flow. Okay, if you understand the direction, then this is very easy. Okay, so we've got the superior sagittal sinus there, the inferior sagittal sinus heading back there. And here we have the great cerebral vein, which is actually directly draining the bulk of the brain. Okay, and when it meets the inferior sagittal sinus, it forms the straight sinus, which literally goes bang straight back across the tentorium cerebelli, and they meet at this particular point here. Okay, this is called the confluence of the sinuses. Now, if I show you where that is on this model here, okay, you see that? Okay, so looking, this is anterior, this is posterior. Okay, so the superior sagittal sinus is across there, the inferior is across there, the straight sinus down there, and they meet at this area here. This is called the confluence of the sinuses. Okay, the confluence of the sinuses. Okay, sorry, here's me sort of like, pointing across here. I actually mean down here. Sorry, my mistake. So this is the confluence of the sinuses here. Okay, now where they head, okay, we'll actually follow on this actually, it's probably easier than seeing on the diagram necessarily, is they generally are heading towards the jugular foramen. Okay, now the jugular foramen, remember, is down that way. Okay, so where we go is across here, right, and we're heading transversely, aren't we? So this is the transverse sinus. Okay, so it's the transverse sinus across here. Okay, and we're heading towards this petrous part of the temporal bone. Now, I'll take you back to sort of like to this diagram across here. That there is the transverse sinus across here. Now you can see that there's a lot of activity going on beneath here. Okay, so I'm just going to grab this skull here. Okay, to show you what's going on. So this is where our confluence of the sinuses was, and you can actually see the groove of the transverse sinus there, and that one on that side. Yeah. Now, what happens here is that, can you see this? There's this massive groove going down here, okay, in our posterior cranial fossa. Can you see that properly? Okay, huge groove. Can you see that? I'll tell you what, let me just turn it that way for you. How's that? Yeah? So, it's coming down in an S shape, okay, and anything S-shaped in the entirety of medicine, right, is always called something sigmoid, okay? So this is the sigmoid sinus, okay, and it's heading towards the jugular foramen. Okay, the jugular foramen, which we've met before, okay, that kidney-shaped foramen. And as soon as it gets through there, okay, it's called the internal jugular vein. Okay, so that there is the formation of your internal jugular vein. But it's not just contributed to by the sigmoid sinus there, okay, because we mentioned our cavernous sinus across here. Okay, and the cavernous sinus drains backwards, okay, and it has, can you see that groove there? It's a bit shadowy. Can you see that? That there, on our petrous part of the temporal bone, that portion there is a groove for the lesser petrosal sinus, going directly from the cavernous sinus down into the jugular foramen, the lesser or the inferior petrosal sinus. Okay. It also has a route straight across the top of the petrous temporal bone, which is the superior or the superior petrosal sinus, okay, which heads towards the sigmoid again, okay, which is just where we found it before, okay, and heads down there. So just to run through that again, okay, confluence of the sinuses, transverse, sigmoid, okay, cavernous, superior petrosal sinus heading into the sigmoid, and inferior or lesser petrosal sinus heading directly to the jugular foramen, all of these forming the internal jugular vein. Okay, so we met before our external jugular vein formed by our facial veins, our pterygoid plexus, okay, and our retromandibular vein, and we've now met our internal jugular vein, and together these all form the entirety of the venous supply, venous drainage for the head and neck. Hope that helps. Thanks a lot.